Hey guys, so my name is Amanda Wagner, and for this medical terminology project, I chose the urinary system. So I have a few key terms that I'm going to go over with you to explain all the parts and functions of the urinary system. So a urinary system is the body system that begins with the kidneys, which are here, which are reddish brown in color and shaped like a kidney bean, used to filter and reprocess blood. The urinary system and urinary tract is located here in the retroperitoneal space, which is all the space around where the urinary tract sits. There are adrenal glands which sit on top of each kidney, and a fun fact is they are actually not part of the urinary system. They just happen to be on top of the kidneys. The ureters, which are here, they are a 12-inch tube that connects the renal pelvis of the kidney to the bladder, which is here, and they move urine into the bladder. The bladder is an expandable reservoir for holding urine located in the pelvic cavity. The urethra, which is here, is a tube that carries urine from the bladder to the outside of the body. Creatinine is a waste product from muscle contractions removed from the blood of the kidneys. Electrolytes. They are chemical elements that have a positive or negative charge and conduct electricity when dissolved in a solution. The kidneys remove these in excess amounts. Erythropoietin, and excuse me if I say some words incorrectly because these are some pretty tough words, but that is a hormone secreted by the kidneys when the number of red blood cells in the blood decreases. Filtration. That is the process in which water, some nutritional substances, and waste in the blood are pushed through the pores in the capillaries of the glomerulus. Reabsorption. Process by which water and nutritional substances in the filtrate move out of the tubule and return to the blood in a nearby capillary. Renin. That is an enzyme secreted by the kidneys when the blood pressure decreases. Urea. It's a waste product from the protein metabolism, and it is removed from the blood by the kidneys. Uric acid. It is a waste product from the purine metabolism. It is removed from the blood by the kidneys also. Urination, which is also known as voiding, is a process of expelling urine from the body, which we call passing water. Urine. That is water, waste products, and other substances excreted by the kidneys and stored in the bladder. Renal artery, which is here, that supplies the kidney with blood. Renal vein, which is there, drains the blood from the kidneys and empties it into the inferior vena cava, which is here. The inferior vena cava carries deoxygenated blood to the right atrium of the heart. The renal vein, the abdominal aorta, which is here, provides blood to the organs and tissues in the abdominal cavity. So, what really is the urinary system all about? It's compiled of the four main parts that I just went over with you: the kidneys, the ureter, the bladder, and the urethra. They all work together, and the purpose of this system is to filter blood and remove waste from the body. It removes waste by producing urine. Tim Taylor, an anatomy and physiology instructor from InnerBody.com, uses a pretty good analogy for explaining the urinary system. He compares the ureters, bladder, and urethra, urinary tract, to a plumbing system that drains the urine from the kidneys, stores it in the bladder, and then releases it during urination. Dictionary.com defines homeostasis as maintaining internal stability. Taylor explains that in the urinary system, they also maintain homeostasis on a lot of different levels. So, it keeps the water, calcium, and ion levels all stable while maintaining a healthy level of pH and blood pressure. The kidneys help to keep a normal blood pressure. They do this by reducing the volume of blood by adjusting the water level. If the blood pressure gets too high, they will reduce the water. If the blood pressure is too low, they'll increase the water. The urinary system comes along with a lot of associated diseases. Some common diseases of the kidneys include nephrolithiasis, or kidney stones as we know it, hydronephrosis, which is the enlargement of the kidney, glomerulonephritis, which is an acute infection that arose from a previous infection, polycystic kidney disease, which are cysts in the kidneys that destroy the nephrons, causing kidney failure. And lastly is renal failure, which is when the kidneys stop producing urine. Some common diseases of the bladder include bladder cancer, which is obviously cancer of the bladder, cystitis, which is inflammation or infection of the bladder, cystocele, which is a hernia where the bladder bulges, overactive bladder, which is the constant urgency to urinate, and urinary retention, which is the inability to urinate because of an obstruction. Some common diseases of the urethra include epispadias, which is when the urethral meatus is in an abnormal spot on either a male or a female. Urethritis, which is an inflammation or infection of the urethra. Some common diseases that deal with urination include albuminuria, which is the presence of albumin in the urine, anuria, which is the absence of urine production as a result of acute or chronic renal failure, bacteriuria, which is the presence of bacteria in the urine, dysuria, which is the difficult or painful urination, enuresis, which is the involuntary release of urine, frequency, which is urinating often but in very small amounts, glycosuria, which is glucose in the urine, hematuria, which is blood in the urine, hesitancy is the ability to initiate a normal stream of urine, hypokalemia, which is a decreased amount of potassium in the blood, incontinence, which is the inability to keep urine in the bladder, ketonuria, which is ketones in bodies in the urine, nocturia, which is the frequency and urgency to urinate during the night, oliguria, which is the decreased production of urine due to kidney failure, polyuria, which is excessive production of urine due to diabetes, pyuria, which is the white blood cells in the urine indicating that there is a urinary tract infection, and urgency, which is a strong urge to urinate and a sense of pressure in the bladder, and lastly, UTI, or better known as urinary tract infection, which is a bacterial infection somewhere in the urinary tract caused by bacteria called E. coli, which is found in the intestines and rectum. And UTIs are more common in women than they are in men. The urinary system also has a lot of associated tests and procedures to take care of these diseases. Some tests and procedures include blood test, urine test, radiology and nuclear medicine procedures, diagnostic test, medical procedures, and surgical procedures. The BUN, B-U-N, or blood urea nitrogen test, is a test that measures the amount of urea in the blood. BUN monitors kidney function. The creatinine blood test measures the amount of creatinine in the blood. A culture and sensitivity is a urine test that is used to identify the cause of a urinary tract infection. UA, also known as urinalysis, is a urine test used to detect substances in the urine. A pH test is a urine test that measures how acidic or how alkaline the urine is. IVP, or intravenous pyelography, is a procedure that uses x-rays and dye to view any obstruction in the urinary tract. A renal scan is a procedure that is used to look for signs of organ rejection after a transplant has been done. An ultrasonography, or sonogram, is used to see kidney stones. Catheterization is a procedure where a catheter is inserted through the urethra into the bladder to drain urine. Dialysis is a procedure used to remove waste products from the blood of a patient with renal failure. A cystotomy is a procedure used to remove the bladder because of bladder cancer. A cystoscopy is done to examine inside the bladder and is inserted through the urethra. A kidney transplant is used when a patient has a damaged kidney and one is provided by a donor. Lastly, a lithotripsy is a procedure that uses sound waves to break up kidney stones. Some common drugs used to treat these illnesses are antibiotic drugs, which treat the infections, antispasmodic drugs, which treat overactive bladder, diuretic drugs, which treat high blood pressure and congestive heart failure, urinary analgesic drugs, which relieve pain, and lastly, potassium supplements, which replace the potassium lost after taking diuretic drugs. So, overall, the urinary system is a very important system for our body. It pretty much keeps us clean, it keeps us healthy, keeps our body regulated, and it just really works together to make sure that we maintain a good homeostasis. So, thank you.